Hello, Prosper ISD, Greg Bradley, Deputy Superintendent, and I wanted to come to you today to give you an update on our COVID situation now 9 weeks into school. I know that 3 months ago when we started, there was a lot of fear about bringing kids back in person to Prosper ISD, and we were the first district to come back on August 12th. And so I wanted to take just a minute to give you an update on where we're at. To date, we have about 12,700 in-person students and over 2,300 faculty members here on a daily basis. Additionally, we have almost another 2,000 students that come to Prosper ISD for part of the day. So routinely, we have about 17,000 people on our campuses. To date, we have had 186 cases of COVID-19. Many of those cases came from community spread that had nothing to do with Prosper ISD. But in each and every case, our nurses and administration have spent time looking into the case and seeing if any of our students or staff would be a close contact. And I want to talk to you about that for a minute today because back in the summer we got some conflicting guidance from our legislative authorities and local health department, TEA, CDC. There was some conflict over what was considered a close contact. The CDC basically said that face coverings didn't matter. If you were within 6 feet, you were a close contact. TEA took another position and said that if you were wearing an appropriate face covering, it did not count as a close contact. And we were forced to interpret. And being the first school back, we took a middle road. We basically said that the face coverings mattered unless the exposure had been particularly intense or particularly lengthy. So if it had been a long time exposure or if there had been an intense exposure maybe in an athletic or fine arts type situation that was a little different than just sitting in a classroom, we qualified those students and staff as close contacts. We have tracked every bit of that data for the last 9 weeks. Over that time, we have excluded over 1,000 staff and students and quarantined them for 14 days as the guidelines require. Of that, less than 4% of those students and staff have ever tested positive for COVID. Furthermore, when both the positive case and the close contact were wearing an appropriate face covering, less than 1% of those students and staff tested positive for COVID-19. Because of that, we are going to adjust our protocol to go back to what TEA said in the summer, and that is if the positive case and the student or staff member are wearing the appropriate face coverings, we will not qualify that person as a close contact. In doing so, we will limit the number of students and staff that we're quarantining, allowing more students and staff to experience the in-person education experience that they chose and that we desperately want to provide. We are doing this based on that data from the first 9 weeks. However, I want you to know that we are constantly evaluating this data. And we know that if we go 6 more weeks and the data change, or we see a huge rise in cases or a huge uptick in close contacts, we may need to evaluate and come back to you and adjust. We're in the midst of a global pandemic the likes we have never seen. But we knew there would never be 0 cases. We knew that we would have to learn how to live with this situation. And I am proud to report that what we have done has been amazingly successful. The effort that has been put in by our custodians, by our staff, by our administration, and by our campus nurses to limit the spread of COVID-19, to immediately respond anytime we were made aware of a case or frankly a rumor of a case. We have left no stone unturned to try to make sure that we are protecting our staff and students because we desperately want them in school. We believe passionately that the best thing that we can do as Prosper ISD is educate your kid. And that's what we want to do. And so we are changing the definition of a close contact for us today. Again, it could change in the future as we evaluate the data, and maybe we will have to reevaluate. But if we continue on the trend we're seeing, what we are doing is working. It is protecting our kids, and we are providing the education that you have tasked us to do. And so I want to thank you for entrusting us with your student. You sending them every day is trusting us with your most precious asset. And so we thank you for that. And I want you to know that we're committed to continue to provide the service that you expect from us. And lastly, I want to thank our staff, our students, our nurses, our custodians, our administration for following the protocols that we've set forth. I know they're not fun. I know everyone wants to rip the face covering off and go back to normal. But I appreciate your commitment to following what we've asked of you. It has allowed us successfully to educate your kid while limiting the spread of COVID-19. If you will continue on with us in this fight, I know that we will be successful. Thank you.